Good morning. I'm Councilmember Vincent C. Gray. All right, we'll start on my left and your right. Go right ahead.
Thank you for this opportunity to testify on a very critical issue. My name is Ann Kenkel, and I have been a resident of DC for 30 years, and I have worked here for 40. I'm a small business owner with an interior design practice. Many people in assisted living facilities are being abused and neglected. As the committee carries out its oversight of the Department of Health in preparation of the 2019 district budget, I ask that members increase the capacity of regulators to ensure the proper training and conduct of those providing care to some of the most frail residents living in long-term care facilities in the district. In 2015, my mother, Sarah Kenkle, was admitted to the Methodist Home on Connecticut Avenue. It is now known as Forest Hills of DC. She was 92 years old at the time and recuperating from a broken pelvis and shoulder from a fall in her apartment. She was at the Methodist Home for about 3.5 months. During this time, I visited her often. What I witnessed about the care was horrifying. I witnessed the staff being highly abusive and neglectful to numerous residents. It was perfectly clear to me that most of the staff did not have the temperament to deal with the elderly. Specifically, I saw staff members rough handling the patients and even physically shoving them into wheelchairs. They would speak to patients with a very stern and abusive tone of voice. The nurse's station was often unoccupied with alarms going off from residents who had gotten out of bed and set off the alarm on the safety pad in their bed. The nurses were often found in an adjacent staff break room, laughing, eating, and ignoring residents' needs. My mother told me daily that they were very rough with her and that they yelled at her because she was too slow. Remember, she was recovering from a broken pelvis and shoulder. Every day she told me that the situation was so bad that she wanted to die. Almost immediately, I brought the aides candy, flowers for their desk, cookies in my mom's room for them to try to influence them to be kind to her. It didn't work. Because my mother was so slow, the staff would not even try to get her dressed to go to breakfast and would just bring her breakfast to her bed. She was being completely isolated because she was too slow. When I would visit for a meal, I would call for the nurses to please come put her in the wheelchair, or even go to the desk and ask for someone to put her in a wheelchair, and often they never got around to her until the meal was cold. I believe staff ignored these requests in absolute retaliation because I complained regularly to the senior manager of the Methodist Home about the staff. Nothing ever improved after my complaints. It only deteriorated because I complained. When in the dining room, I saw a number of residents who were clearly non-communicative, sitting just staring into space with their food untouched. No staff helped them eat, and at the time the food was to be removed, they would just remove it untouched. One day after a meal, I asked an aide to please wheel my mother back to her room and help her into bed. I was not able to get her into bed with her injuries. I waited at least 30 minutes and no staff would help me. I finally wheeled my mother back into her room where I thought she could at least sit in her room and we could watch TV together. She was seated in her wheelchair and I walked to sit on the bed. I turned around and my mother had gotten out of the wheelchair and I saw she was losing her balance. I moved as fast as I could to catch her but couldn't get to her in time. She fell straight back on the concrete floor and I heard her head hit the floor. She was rushed to the hospital where she had some fractures in her back. If the aides had done their job and put my mother safely in bed, this would not have happened. The doctor visited the patients twice a week. No one ever knew when he was coming, so I left very specific instructions that I be called when he was examining my mother so I could know her status. 99% of the time they ignored my requests and did not ask the doctor to call me. It did me no good to speak with him once he left the Methodist Home because he would not have her records with him. I did not request that she be transferred to another assisted living facility because hospital social workers had assured me that this was the best facility in DC. We finally arranged private full-time care for my mother in her apartment. 2 years later, when she was ill, I made sure she was admitted to Ingleside to recuperate after a hospital stay. We decided to have her home health care aide stay with my mother every day so she would not be abused as she was at the Methodist Home. However, when I visited, I overheard much of the aides' conversations, and it was clear to me that these aides also did not have the patience to deal with the elderly. Something needs to change to protect the physical and emotional health of our parents and loved ones when they enter assisted living in DC. The bill that each of you co-introduced with Health Committee Chair Gray, B220689, the Omnibus Assisted Living Improvement and Quality Long-Term Care Act of 2018 requires that those caring for frail adults in residential facilities have specialized staff training. It also specifies staff-to-resident ratios so people like my mother don't risk their lives waiting for someone to help them to bed or take them to the dining room to eat meals and enjoy conversation with others. Very importantly, residents and family members are protected from the kind of retaliatory behavior my mother and I experienced. Thank you for your efforts.
Thank you very much, Ms. Kenkle.